start out by saying that I definitely disagree with what our ranking member Rogers said with regard to not having looking at this state by state or localizing it versus having more federal involvement. I mean, I have to take your word for what Governor Inslee said, but I think I agree with him that we need more federal involvement. I mean, part of the problem that I saw in the last 9 months under Trump was that states were essentially left alone, and they were competing with each other for gloves and masks and supplies, and sometimes being gouged with prices. And I do think, and I've said all along, that we need a national strategy, which is what Biden is trying to accomplish. So I understand this one size fits all, but I don't think that necessarily works when you have a pandemic of this magnitude. Now, that isn't to suggest that that this isn't a federal system, where there's a national strategy and we still try to implement this, the response state by state. But the fact that President Trump so much stressed that states were on their own and there wasn't a need for a national strategy, I think was a huge mistake. And I think it was an ideological approach that led to the fact that we didn't have an effective response under the Trump administration. But whatever, that's my spiel. Let me ask this question. Let me go to Dr. Khaldoun. What's happening now, of course, is Biden implemented a three-pronged strategy last week, or started a strategy where he said that we're going to give you notice 3 weeks in advance, so you know what's coming. That's the transparency. He increased the number of vaccines that were coming weekly to the states, and then he set out a plan to actually vaccinate 300 million Americans beginning in the summer and certainly by the fall. So I wanted to ask for your response to that, how that's going and what you think about it. And then secondly, we have a bill. In other words, we have this bill, the American Rescue Plan, that we're going to try to do in the next few weeks, that provides a lot more money for vaccines, for testing. And my understanding at the state level is that the states are still wanting with resources and need that additional money and need it soon, because many of them, we didn't provide any state and local aid in general directly, and many of them are still using their own money and need federal help. So those are the two questions. Once, what about what happened with that three-pronged Biden plan, and whether we need another COVID bill because you're lacking resources?
Thank you, Chairman, for that question. So I've been very appreciative, actually, of the Biden administration. Had several conversations with leadership. We do, for the first time, have 3 weeks of transparency as far as how much vaccine we'll be getting into the state. That's very helpful, because now I can tell my providers that they get a certain amount of vaccine and they can go ahead and schedule. So it's been incredibly helpful. We also are very thrilled that potentially the American Rescue Plan will go through. We certainly need additional funding. Right now, I'm at a point where I have contact tracers that are getting involved in my vaccination efforts. I have epidemiologists who work on lead and other things in the health department who are now being pulled into vaccine efforts. We absolutely need more funding to build out our infrastructure, to bring in more staff to be able to support our vaccination efforts.
And then there's about a minute left. If I could ask the Colorado representative, Ms. Ryan, the same two questions about the last three-pronged Biden announcement and the need for more resources through another through another bill that we're planning.
Thank you for the question. I will say that the transparency and predictability is improving, as are the number of doses. We know those are slowly going to be increasing over the month of February. Yes, we could absolutely use more federal help. We are seeing the same things with our local public health agencies trying to decide, do they put their staff as vaccinators or contact tracers? Still lacking the resources and pulling all the staff they have off of all of their other duties as they've been on along. So I think it speaks to the need for sustainable funding in addition to emergency funding. And we did just get some funds from the CDC and a new ELC grant and other funding, and we will be putting that to good use. But we anticipate you know, this response is going to be with us for a long time. COVID's not going away, and we're going to need sustained dollars.
Thank you. Thank you, Chairwoman DeGette.